The importance of health research in improving the general well-being of any people has become a global imperative for the continued efforts to treat and track disease patterns, risk factors, pharmaceutical breakthroughs, and investment opportunities all over the world.
Since I came, my vision was to make Nimr a more relevant research institute, competitive nationally and of course globally.
The concept of this lab ab initio was to set up a place where we can do some tests that you can only find abroad. Pioneering tests, pioneering things that we need to take care of our people in the health industry.
Essentially to go into diagnostic activities, assessing samples from clients, especially those that have health challenges. We collect samples from them and try to run tests and find out what health challenges they are having.
Investigations have revealed that variants of breakthroughs have been as a result of medical research. According to experts, the high degree of medical health that the world enjoys today is built upon the work and efforts of physicians and scientists in their bid to find out what treatment works better for particular peculiarities of diseases, as well as new discovery, new treatments, thereby upgrading the quality of life of the people who unfortunately are living with illnesses and diseases.
The very first adolescent clinic, that's clinic for adolescents living with HIV in the country, was started in this department and is going strong. So right now we look after adolescents to ensure that they are not lost to care.
So the Nigerian Institute of Medical Research is the first institution in the country to document what is being used in different parts of the country and how far are they effective. And we have done that in several ways by testing the insecticide that is being used to control these mosquitoes. In some area, the insecticide is working fantastically. It's beautiful. You have 100% control of the mosquito that cause malaria. But in some area, the mosquitoes have also developed resistance. They have become stubborn. Let me use that word. Become stubborn to the insecticide.
So we'll be going to the field to collect bacterial isolates from different labs in Lagos State, selected labs, and we'll come and check them to find out their antimicrobial resistance pattern, so that we can tell what the picture is like, in the country. If we want to know if most of them are resistant, then it's most likely that most of the antibiotics that are being prescribed are not even working. So we just want to know what the picture is like, and if there is resistance to which of these antibiotics is it. So whatever information we get, we'll be able to feed back to the practitioners, and then they'll be able to know that, oh, this antibiotic is probably not very effective again because most of the organisms are resistant to it. That's the kind of information that we're going to derive from it, which will help influence policy.
And I can say that this is one of the few labs where we do actual culture of this organism. My collaborators that are gastroenterologists, I have them in Luth, I have them in Lasut, I have them in UCH, I have them in Ife, I have them in Benin, and I have them in the north, just one of them from the north. But basically what they do, if they have issues of treatment failure, they usually send patients to us here to do the actual culture, so that they could see if they could improve or change the treatment regimen that they use so as to improve the health and well-being of people that have peptic ulcer diseases.
Medical research in Nigeria through the years back served the nation and alleviated some challenges. Same cannot be said of what is obtained today with some research materials and findings.
Late 80s, our department developed a fermented food which we call dogic. And the essence of that is we found out that Nigerian infants were usually weaned into foods that do not support their body growth and development. And what they are having is winning them into foods that make them to be more malnourished.
Myself and one Professor Harry, Tekena Harry, and we started working, and we said, oh, we can't wait for them, but let's see what are the simple things we do. So the small effort we put at NIMR did a lot for Nigeria. For instance, we provided full rabies service, anti-rabies service for Lagos, and many states came to us for prevention and control, and it worked. Secondly, within that small laboratory that we had, we were able to upgrade that lab and start working on viruses that included influenza viruses, and the two of us diagnosed the first cases of AIDS, HIV/AIDS in Nigeria at NIMR.
Research efforts are not encouraged, and when there is any, it is grossly underfunded. This therefore leaves much to desire when you consider the place of research in the Nigerian healthcare system across the tiers.
When Ebola broke out in this country, it's unfortunate, taking it to Institut Pasteur in South Africa, in Dakar. Those are things we can do if the enabling environment funding are provided by those concerned, government and the people of the country.
We wrote some proposal to WHO because I know they also have a center for alternative medicine in there. So we've written to them, and we are still trying to get if they can sponsor it. And like I said, one of the things that makes sponsors to sponsor your project is you must have done a proof of concept. You must have done a preliminary study. So say that I've done this one, this is the result I got, but I want to do a larger study. So with that, they can now fund you. So that's why we want to do a proof of concept for some of these products. Thereafter, we can now write so that we can see if we can get a grant to continue with it.
Research materials that could move Nigeria forward are stored away in shelves, and nothing is heard about them afterwards.
This is the Central Research Laboratory of Nigerian Institute of Medical Research. The reason for setting up this unit is to have a place where certain specialized equipment can be located. Certain specialized equipment can be located that serves researchers and scientists working in this facility and in other facilities in Nigeria.
In 2006, they are trying to start up testing babies using what they call dry blood spots. If you're going to test a child and you want to pick a sample and you're coming from a long distance, you have to carry cold chain and maintain temperature. But now we had to use DBS cards that can carry just like postage mails and send it to a lab. So this place actually piloted it in Nigeria, and currently that's what is being used nationwide for testing babies and all that. And we're trying to see if we can use that for viral load.
We know that it's not easy to diagnose TB in children because they're not able to produce sputum. So we're looking at alternate samples that can be used in diagnosis of TB within this population.
Initially, they were using branded retroviral drugs from the West, which was quite expensive. But then the generic products came up, and there was this controversy. Could we use generics? Was it inferior to the branded medications? So the landmark study from this institution showed that the generics were as effective or efficacious as the branded. And so that led to policy change.
One of the principal ones is that, the advent of HIV/AIDS, and when AIDS was almost like death sentence, NIMR was among the institutions in the world that conducted research that shows that HIV/AIDS could be managed with less expensive drugs, and that's actually led to the global crash of the HIV drugs, and improved access to HIV globally.
A lot has been done by Nigerian researchers in the medical field to mitigate ailments over the years, but ends up as archival materials and in some cases taken out and utilized elsewhere outside the world. Not much has been done to fund research to properly integrate it into development, yet it remains central and salient to effective planning and remediating the daunting challenges in the nation's healthcare delivery system.
But research is so important that it goes with development. That's why it's called research and development. So a nation that hopes to develop must necessarily put money on research, not donor fund. Because what we get is, oh, go and compete for grant, go and. We are competing for grants. They are peanuts when they come to what problems we want to solve in Nigeria. The country must have dedicated fund for researchers in Nigeria.
I think NIMA should have a dedicated line from the national grid to supply us power, because it's very disheartening when you're conducting work and light goes off. And if for any reason the alternative power supply, which is the generating set, if for any reason they are faulty or something, that just makes a mess of the whole work.
You know, that's another challenge, which even a lot of times, if you are collaborating with people from advanced country, that's an excuse you cannot give them. It's totally unacceptable to say because of electricity you're unable to do X, Y, and Z. It's totally unacceptable.
Like I mentioned, that we are trying to formulate our own things, but even sometimes while we are making a formulation, you might need to import some of the things you require. We always have problems of customs. For sometimes customs withhold the things, or the person bringing it in. Even when you have to tell, oh, yeah, it's coming to Nigeria Institute of Medical Research, it's a federal government establishment, why do we have to pay this much import duty or on it? That we are not reselling, we are using it for research into the country. We have such challenges. Again, we also have problem with NAFDAC sometimes, because even some of the people that supplies will tell, oh, it has been held by NAFDAC. Even when you give them a letter, they'll say NAFDAC is still charging them to bring the thing in. It makes research more expensive in the country, because what your other counterparts are getting locally, when you're bringing it in, even when you factor shipment into it, you still have to factor custom duties, you have to factor paying NAFDAC out of it. So I think the government can help put up policies, especially when the institution is probably a non-governmental organization that's not making money. But this is a governmental organization, but it is not making money for itself. We are trying to, that's why we came out with some of these things, developing, research and innovation that will come up with the products that you develop. It will not only make money for the institute, but in the long run for the country at large.
Sadly, this is the fate of the Nigerian Institute of Medical Research. Situated at the heart of Yaba in Lagos State, it was established by the federal government of Nigeria to promote national health and facilitate developments in the health sector. Until the establishment of the National Institute for Pharmaceutical Research and Development, NIPRID, the Nigerian Institute of Medical Research was the only institute in the country specifically designated for medical research.
We have a three-pronged mandate to conduct research, do capacity development, and provide service.
The organogram of the institute, it has 5 research departments that conduct research into disease of public health importance in the country.
What this means is that diseases that are ravaging the Nigerian population, that causing significant morbidity and mortality, causing illness and death, such that we can look at them and find ways around what is causing the disease, how do we detect them, what can we use to treat them, how do we prevent them, so that it stops causing significant morbidity and mortality among our population.
Being the foremost and oldest organization for research in Nigeria, from its modest beginning in 1920 as the base for the Yellow Fever Commission for West Africa and becoming the seat of West African Council of Health, later to become the Nigerian Council of Health at independence in 1960.
It is the foremost medical research institute in Nigeria, and all issues that has to do with medical research in Nigeria are supposed to be tackled here.
The board and management of NIMR have developed a strategic plan for the institute, as well as commission an innovations department which has manufactured homegrown equipment as solutions to the nation's healthcare needs.
We have a unit we call Research, Innovation and Product Development Unit, which we created about the time that I resumed as the Director General here. And we have been able to come up with 4 innovations from the unit.
We have NIMR Biotech Incubator, we have NIMR Biotech Oven, we have NIMR Biotech Burger Centrifuge, we have NIMR Biotech Hematography Centrifuge, we have NIMR Biotech buffers, we have buffers we are producing, we have a lot of things we are producing for the public to use.
And because most of the things we do here is research, we also felt that pain. So one of our researchers, Dr. Muinat Fowora, had to come with the idea of preparing the reagents locally, 100% preparation locally, and it's been tested with all sorts of samples, saliva, blood, dry blood, even tissues, and been found to be very effective. And this really will be much lower in terms of costs compared to the imported one. It's been tested with the gold standard, which is the imported one. It works as much, if not better.
The plan has addressed several challenges of the institute. It addressed the attrition rate of researchers who erstwhile was stagnated with due alignment and synergy with the academia. Researchers can now rise with due pride to the peak of their occupation.
The major problem we had in the institute was the organogram. The institute was structured such that the head of the institute is a director, and there was only one position for a director in the institute. So when I joined the institute in 1980, there were several of us from all over the world, Nigerians and non-Nigerians, from Canada, from US, from England, from all sorts of every country. We all started working with enthusiasm, but the problem that the institute experienced was that as soon as you hit the position of a chief research fellow, there was no more progression for you.
So a lot of people were stagnated in one position and they were not being promoted. So those who are behind them, who couldn't move up, were all leaving. And we had to make an overture to the office of the head of service to defend personnel budgets and explain to them why NIMR should not be seen as the run as Ministry of Health, but rather as an academic institute, so that those who are capable of becoming directors will become directors, rather than having one director and until he retires or dies, nobody else becomes director.
Looking at the nation's fragile health sector against the background of global health challenges, and given the fact that Nigeria remains the epicenter of global investments, meaning therefore that Nigeria at this time, it is important to activate its guard, deploy her medical research resources, and be guided appropriately to ward off or help contain any epidemic or human migration diseases and spread?
Well, the way forward is, well, to create a very strong advocacy to enhance the priority for health research by various governments, the federal and state governments of Nigeria, to be able to increase this government subvention for research. We need to carry out this advocacy to our National Assembly and then to the Ministry of Finance and to, various government functionaries.
Proper investments in research for development has limitless potentials for the nation's health sector with the right dynamics of staffing and progression now in place.
I mean, the little fund that we got from federal government, which we have used and applied judiciously, have given us about 4 innovations.